The strike by healthcare workers affiliated to NEHAW continues at some hospitals in KZN.
In fact, workers have blocked entrances and burnt tyres at Grays and Northdale hospitals. They're demanding a 10% increase and a housing subsidy hike from 1,900 Rand to 2,500 Rand. Newzroom Afrika's Nobuhle Modise joins us live from Grays Hospital in Pietermaritzburg. Nobuhle, there's already plenty of discussion in the morning papers around the very real impact on patients insofar as the strike is concerned. What's that hospital saying?
Indeed, Michelle, the health sector has been brought down to its knees as they've blocked the entrances to some of the hospitals here, like at the Grays Hospital here in Pietermaritzburg, where I'm standing outside of. And essentially, this does affect patients who are unable to enter here. As we drove in here, we also saw a lot of doctors. I'm going to ask my colleague, Gifton Gosu, to just pan for you and show you the pandemonium that's here with cars that are parked on the road. Doctors are unfortunately unable to enter the hospital, as well as some of the workers, and unfortunately the patients as well, as you've mentioned. And this has essentially just brought the health sector here in the province and everywhere else where we've seen this kind of strike action happening to a standstill. And those demands that they are saying they want are that 10% hike across the board, as well as that housing subsidy increase from 1,900 to 2,500 Rand. I'm actually joined by the regional secretary of NEHAW here in the province, Mazwi Ngubani, to just chat to us about some of those demands. We do understand that yesterday as well, the government, the provincial government, the provincial health department did come out saying that they must remember that there's a no work, no pay agreement between the union and the hospital. Thank you very much, Babu Ngubani, for joining us. Speak to us about, how long this is going to take and what the conversations you've had with management, particularly at this hospital, for example, have come to.
No, thank you very much. This is our day 3 of the public service strike as NEHAW. This would be an indefinite strike because we tabled our demands last year, and our demand was 10% increase, and the employer unilaterally implemented to 3%. Then we said, no, we cannot accept that. As you know, that the cost of living are escalating. They are very high now, and the workers cannot afford anything. So we still demand our 10%. There's 7% remaining because the employer unilaterally implemented with 3%. That is what we are demanding. And also e-housing allowance to go up to 2,500. That is what we need. There are so many other demands, but we are angered by the arrogance of the employer. Yes, in this hospital, in fact, all the hospitals in Pietermaritzburg and also in the Herikuala region, they are all closed until the employer meets our demands. Yeah, there has been some, I will not say it's a confrontation between the management, just that they are raising the concern that there is no skeleton staff. And as a union, we met the HOD on the 3rd of March to discuss the skeleton staff, but due to arrogance, they said they cannot negotiate that. That is why there's no one working in the hospital, and it's not our intention to make the strike affect the community.
But it is essentially affecting the community. Some people are saying that they're being turned away. In fact, they can't enter because you have blocked the entrances here. Speak to us about what the bargaining council has said thus far. Okay, yes, the community is severely affected by this action, and we hope the government will see that and come back to the table. Yes, we are quite aware that the bargaining council, which is the PSCPC, there was some communication that the parties and how when the employer must go back to the table, I think by tomorrow morning, but we are still waiting for that from the employer. But we know that there's that communication that we must go back to the table, and we'll appreciate that because we don't want to see our community being affected like this. Yes. Thank you very much. That is Mazwi Ngubani just speaking to us about why it is that they are not backing down from that 10% hike that they're saying that the employer did unilaterally last year, implement that 3% increase that they didn't ask for. Also speaking about the fact that the bargaining council has come back to them and saying that they are willing to go back to the table and have more discussions by tomorrow. But until then, they are still going to continue with the strike action here. And Michelle, I just want to show you the scenes here quickly before I cross back to you guys just to show you what is happening here and how long the queues are in terms of people trying to enter the hospital and being, stopped from doing that. Some doctors are standing outside. The cars are about, if we walk down, it's about 1 kilometer long of cars that are just parked on the side of the road, and people cannot enter, and those who are inside cannot go out. And you heard Mazingubani also speaking to the fact that there isn't even skeleton staff, which is essentially a huge problem, because that means those patients that are inside are also suffering the consequences of this. And we know that on Monday they were just doing surgeries, but at this point we're unsure what the situation is like, because ambulance services have also been affected, and the entire health sector, like I said, has been brought to its knees. Back to you, Michelle.
Yeah, surely there will be a much larger impact than we've already seen if this protest action continues for much longer. Nobuhle Modise says live to us there at Gray's Hospital in Pietermaritzburg. Thanks for that update.